that they reported a loss of 1.2 billion last year. Welcome once again to the Empowering Patients podcast, your weekly take on all things related to new care models in healthcare, remote patient monitoring, chronic care management, and hospital at home. I'm your host, Theo Harvey, and I'm the co-founder of SynsorMed, the leading full-service RPM platform in the industry. Today, I also have on the podcast Prince McKinney. Hi, Prince. How's it going?
I'm doing well, Theo. Thanks for having me.
Of course. Prince has over 10 years of total experience in the industry and consulting across a range of different industries, business models that include life sciences, healthcare, higher education, academic medical centers, consumer products, financial services, and supply chain logistics. So his deep experience, including accounting and finance operations and financial planning and analysis functions, is really going to be important today. As today's topic, Mr. Prince, will be the business of healthcare. So thanks for your time today.
No worries. Glad to be here.
Great. So look, first things we like to do is cover the news. One of the news items that came up today, as we know, we're in an interesting time with stock markets plunging down with other reasons with war, inflation, supply chains. But one of the things in healthcare was insurers going public and trying to expand in the market. One of the more innovative models, Bright Health, was an innovative startup insurance model based out of Minnesota. If you didn't notice, Prince, they were the first unicorn in Minnesota. So basically, they got a lot of funding and they were seeing growth pretty tremendously. They recently announced after they did their earnings that they reported a loss of 1.2 billion last year. And they saw this is driven by 124% of medical loss ratio and massive losses in that quarter. This is huge. Obviously, innovation in healthcare is important, but seeing companies that are trying to do something unique and different, having this much of a loss and that ratio, we'll talk about that later. I think it's something that, for folks getting to healthcare is something to be concerned about. So I don't know, what are your thoughts in broader sense of just the market and what's happened to just healthcare stocks in general?
No, I think that's a great question. I think it's great timing. I think with the SPACs, they went through the SPAC, and I think there's pros and cons of going that route. Definitely around the speed to market. So being innovative, a lot of times these unicorns, they grow up fast. They want to get to market fast. And I think the SPAC allows them to actually move with that quickness that they are traditionally used to moving with, as opposed to more of an IPO method. It's a little bit more due diligence behind that, a little bit more scrutiny of the numbers. So I think the sell off is not germane to maybe them, but to SPACs in general. And as it relates to healthcare, we do see rising costs. There are a lot of factors happening now that are putting pressure on some profitability measures. So I think it could be related to a lot of different factors that's going on in the market.
No, I agree. So we'll definitely keep a eye on that as the market changes for everybody, but it's definitely more to watch as a lot of healthcare companies and just companies in general are just getting battered by the market right now. With that being said, Prince, let's dive into some of these acronyms and,
Yep.
here for insurers. So there's one is medical cost ratio, the medical loss ratio. Can you break down a little bit what these mean for insurers and why they're so important?
Yeah. Great question. So the medical loss ratio is essentially the total share of healthcare premiums spent on medical claims to help improve the quality of care. And this is important because through legislation, insurers have to spend at least 80 to 85% of their premiums on medical claims or to improve cost of care, right? So premiums are the money that they collect. That's the money that they collect from our monthly paychecks or whomever you buy your insurance from. And 85% of that needs to be paid out of medical claims. So in a situation where your claims is higher 122%, that lets you know right there, you spent 22 percent more than you actually collected. So that definitely hits your proper profitability. If you think about it like that, you collected $100, but you spent 122. You won't be in business very long if that's a business model. So insurers could be beating that 80 to 85% range because one is mandated. And then two, anything, if they spend less than that, they actually have to refund that money back out to their insurance class. So this is very important when you think about the profitability, because if they're spending too much in claims, it's putting a pinch on revenue, because there's no mandate to say you can't spend more than 85%. But if you spend less than 85%, then you have to refund that money out. So it's a key measure in the profitability for insurers.
That's a good way to think of it. So basically, the claims are basically providing those services that patients and beneficiaries need. And they're mandated to spend that much money, but they're spending so much to take care of their beneficiaries, then they're not going to be profitable and they'll be out of business. We'll talk about it a little bit later, but that's why it's important for them to find ways to treat these patients at a high standard of care, but maybe at a lower cost, right? So they can keep those patients from spending a lot of costs and taking care of. So that's interesting when you think of it. And it's one of the things why also probably insurers are also looking at what their different the patient population to determine which patients spend the most money when it comes to care and which don't, which tend to be younger folks and older folks spend more money. So they are what's that term? I guess they're looking for the right patient mix, right? Make sure
Yeah.
that many issues there.
Yeah. The demographics are definitely important to an insurer, and it's based on your strategy, because you have some of these newer interest into the market going after the Medicare base, because as we all know, there's an aging population here in the US. So one of the growing sectors in the healthcare within insurance anyway is that Medicare C plans that are through private insurers. So you get the same benefits of Medicare, A and B, but it's through a private insurer and not the government. So you see a lot of these companies springing up to take advantage of that growing population, or as they call it in the insurance business, agents. You agent to, Medicare.
Yeah, that's a good question. Maybe off the wheel here a little bit, but when you say that, so private insurers can taking over Medicare. So what are Medicare Advantage plans really? Are those the private insurers taking over Medicare? And in theory, they should be able to, there's some cost cutting they can do or some better efficiencies they can gather to make that a little bit more efficient when it comes to that, or how to
Yeah,
break that down a little bit for me.
yeah, exactly. So Medicare C is essentially Medicare A and B. The Medicare A and B were originally legislated through Congress. But in order to bring down the cost of care, the government started allowing private insurers to offer those plans. So that's how you get this second market of Medicare C and not going through the traditional government. And you hit it, you said it exactly. As a new entrant, I think I can provide these costs at a better quality, less expensive, more efficient, and drive better patient outcomes than going more of the traditional route. Yeah.
Yeah.
So yeah. So that'll be the motivation, that they believe they can come in and provide these services with better quality and more efficiently.
Yeah. And make sure I'm clear. Medicare C, is that the same as Medicare Advantage or is that a separate category? Does that make sense? Or
Yeah, no, it makes sense. So Medicare C is the Medicare Advantage. You have A and B, which is the traditional. Then you have C. Then you have D, which is the dental and things like that. So it's a lot kind of going on there. But with the private insurers, they can carry the C, which is A and B, either, or you can have the D as well, which is the dental. It's supplemental. Yeah.
okay, so that makes sense now. So Medicare Advantage is one of the fastest growing Medicare plans. I think they're trying to get more and more folks on that plan. I think it's been the highest it's ever been, almost close to, they're saying projected, I think 50% will be on Medicare Advantage next several years. So I think they're really pushing Medicare Advantage and to your point, to pushing it to the private insurers to innovate and find more efficiencies. And so that's why I was driving, we'll talk about it. So it's all kind of making sense now. I was driving innovation in general because as we know, you can get some productivity gains with technology, right? And just we see that in our work lives, with healthcare the same way, right? And virtual care solutions and services help with that. So that's why a lot of these Medicare Advantage programs are looking at technology to help with those, lowering those costs of delivering care. So it's all clicking together because that's why I wanted to have this conversation around healthcare finances because you see how it flows into what's this record number of digital health companies out there, right? That $1 billion, there's a unicorn almost every day with digital health companies. So
Yeah.
this is interesting where this is going. Speaking of that, let's pivot a little bit. So let's say, okay, look, I'm an innovative digital health company or insurer, and I'm growing. I need more growth, so I'm going to go IPO are going to go to public markets, right, and get out of private markets. So there's this big push with these special purpose acquisition classes or SPACs. And we saw a lot of healthcare companies taking advantage of this, like get into the public markets. What are your thoughts there with insurers or digital health companies in general going that route? What's the pros and cons, and what are some of the things that you're seeing shake out now?
Yeah, no, I think the pros are definitely a double-edged sword. In some respects, are the cons. I think I alluded to a little bit earlier. Just the speed to market with the SPACs. They're able to raise the money. Investors are able to raise money beforehand, and then they then merge with those already existing companies. And there's less scrutiny, less due diligence involved in that type of transaction, as opposed to the traditional IPO route going public. So it's the speed to market. It's a lot faster, but at the same time, that becomes the risk as well because they're not as, in some cases, may not be as well vetted as a traditional IPO approach. I think with the size of the potential market within healthcare, and this is a great time to really be within this industry because you do see this digital revolution. You do see these entrants and new players into the market, and the technology is enabling all of that. And fueling that is this ability to go to market a little bit faster through these SPACs, right? So I think that's really driving it. But it's really a great time to be within the space because growth opportunities are there.
Definitely. One last question here. We talked about it, growth opportunities, still in healthcare. I mean, the pandemic, transformative. I think someone said one time we went 10 years in innovation progress in 1 year with the pandemic, right? We saw a record number of telehealth visits, space I'm in, remote patient monitoring took off. So there's a new ways of delivering distributed clinical trials. That's another big hot area right now where we're actually doing clinical trials remotely with patients. So this is great, but where do you see the innovation coming to healthcare finance? Like, who's going to pay for all these tools and technologies so that we can enable better care for patients?
Yeah. And so I think it'll pay for itself, right? Because the investment is meant to drive increased quality, increase patient experience, but at the same time to decrease cost.
Right.
If you increase the other two and you decrease the cost, it naturally funds itself because those lower costs you can then reinvest back into the business. So I don't look at it as being who's going to pay for it, whether it's uh, patient, you and I, or the government, but rather the investment should pay for itself through increased efficiencies, low cost of delivery, increased outcomes, more preventative health. So people transitioning from sick care to more preventative care. So I think these tools and these investments will eventually pay for themselves.
I like what you said about preventative tools too, right? And we get ahead of it. Some of these beneficiaries who are spending more on claims, they're taking care of themselves better. Even my space, or remote patient monitoring, I think people who monitor themselves every day is changing habits, right? So they can manage a chronic condition so they don't have an exacerbation and have to go to the ED, which can cost tens of thousands of dollars to the healthcare
Right.
system. So so these cost savings mechanisms, I think will have a long-term play for the future. No, said, Prince. I really appreciate it. Prince, thank you so much for your time today. I really appreciate you sharing your insights and knowledge for our podcast. Before we end, I want to thank everyone else for joining today. As we said, please subscribe our podcast on Apple, Spotify, Stitcher, and wherever you listen to podcasts. We also have a YouTube channel as well where you can watch us there weekly. Thank you again for being on this journey with us toward better patient health. Take care.
Got the kick.